Hello everyone, welcome back. My name is Milan Jacob and today's OET All-Stars is from IRS Group, one of the earliest premium preparation providers and the first OET All-Stars in Asia. So today we will be dealing with speaking, and I'd be discussing a lot of important aspects which will be important for your speaking. So if you're able to watch me and listen to me, in the chat box, please let me know where you're joining from. I'd be happy to respond. Here we go. Right. I'd also like to know if you are having an upcoming test. So that should also be something which you can tell me. And I'll be sharing a lot of helpful tips for your preparation. So let's get started. So I'll just wait for you to let me know that you have joined and I'm audible. Right. Okay, here we go. So please let me know in the chat box where you're joining from, and it's going to be a lot of learning today. So, right. Just trying to get the chat as we talk. Okay, so today's topic is basically the patient's right to uphold their views and opinions. So, excellent. Right. Okay, hello, Masa. Hello, Amani, Kulri, Sanju. Hello, Rajana. Good evening, everybody. So good to see all of you after some time. We were plagued with some technical issues in the recent sessions. So good to have all of you back, and great to see every one of you. Excellent. So, yep. So I'm just going to share a few thoughts on what the patient's rights are and why it's important. And then we'll have a couple of activities which will be helpful for you. So a quick reminder of patient's rights, and I'm sure you must be quite aware of a lot of them. Yes, a few more of you have joined. Deepa from Nepal, hello. Asuman, hello. Andrea, hello. Good to, Andrea is from Colombia, excellent. So good to see all of you from across the globe. Right, so the patient has a right to be informed and to be involved in their own care. I think that's something that you are aware of. So please, we discuss a lot about the patient's right to information. And at least in some parts of the world, it used to be withheld from the patient temporarily, but now we have a greater emphasis on patient-centered care across the globe, whether it's in the West or in places like here in India where it wasn't as important. There's a greater awareness, and thanks to a lot of OET candidates who are actually spreading that information. So, so this is something which is very basic. Right, so hello, Hilda from Zambia. Now, patients have the right to express their views and have them respected by healthcare providers, professionals. So that's again something which I guess you must be aware of, but in the context of OET speaking, this is very important, and we have criteria. So if you know, you can type in which the criterion is, which is related to it. But we'll be discussing it as we go forward. patients have the right to make informed decisions about their healthcare, right? So we often hear that it's their body and their right to decide what sort of treatment or care they require. So that's again important. And they have the right to be fully informed about their medical condition, treatment options, and risks, right? So that's also something we should really look forward to as we go. Now, this is just a quick reminder of some of the aspects of patient rights, which you are aware of. And finally, patients have the right to refuse treatment, even if it may be harmful to their health. Now, this is very important and quite controversial as well, because we have had instances when, I remember reading something that happened, I suppose, in America a couple of years ago, when a patient had a tattoo on his body which said DNR, and the patient was brought into the emergency department unconscious, and the ethics committee of the hospital convened and decided not to resuscitate. And later, it seems a court in America upheld the decision of the hospital not to have resuscitated the patient, because if someone had taken the pains to tattoo a DNR decision on their body, then that must have been their will. And so you can find a lot of interesting reading on this aspect. Now, here you have a picture of Elizabeth Cohen, who is the senior medical correspondent at CNN, and she had once written an article about this young guy John, who had a headache, but later it turned out to be a tumor, and basically they were able to detect it because the patient and his mother insisted that it wasn't just headaches, although the hospital initially ruled out anything serious, right? So let's head into our, we'll head into some activities. But before that, I want to run you through what happens when typically a health professional encounters a patient. And it's not something that happens all the time, but this is something that could happen. Or I want to highlight the difference of opinion between them, or the reason why they don't understand each other's views. So here you have a health professional who is thinking, I know what's best for you. And the patient has his thoughts, which is like, I have my own view. So let's see the nuanced, subtle thoughts that go with it. So when the health professional is looking at it, their perspective is the sequence of events, system review, symptom analysis. So they're focused more on, the biomedical perspective, whereas for the patient, it's the effect on their life, their expectations, concerns, ideas, and beliefs. So you find that sometimes they don't meet. And now, one of the most commonly followed models of consultation today in the world is the Enhanced Cambridge Calgary Guide. So the guide basically considers these two aspects, the biomedical perspective and the psychosocial aspects. And they have to be brought in together. And that's exactly what happens in the OET speaking test as well. So it's very important that you consider the patient's own side of viewpoints, their thoughts. So I've got a couple of scenarios for you, and I want you to spot the problems in these settings. So here you have a patient who says, I still have the dizzy feeling, right? And the health professional is telling, don't worry, we'll be gone soon. The medicine is just starting to work. In your chat box, can you tell me what the problem is? I'm just waiting for your response on what the problem is. Now, if you are preparing for OET, you should be quite aware of what this problem is. So you can name the problem and let me know in the chat. Foster says there's no empathy, right? Others, you can respond as well. It's absolutely fine, even if it's wrong. It's just a learning process we are in. So just let me know what you think of it. What is the problem in this scenario? All right, so here we go. Yes, there is a priority for treatment over the patient's feelings. Yes, there's lack of empathy. Absolutely, I agree with you. So, Amani says no empathy. Dimelis says the profession is ignoring the patient's concern. That's right. Jessa Jane says did not acknowledge what the patient is feeling. Absolutely. Right. So this should be a thought that, takes priority when you see a patient, or for that matter, in the OET speaking test. Great. So here's the next scenario for you. Sorry, this is what could be done. Before I give you the next scenario, this slide shows a better way of handling it. So the patient's feeling is accepted. You find an open-ended question there. Really, can you describe that for me, please? Which is very good. And then you find it being further elaborated. The patient says, it's like I'm floating. And then the health professional says, I see that it's troubling you, but it will be gone soon. The medicine is just starting to work, and you should be all right within half an hour. Hilda says no empathy, and the nurse didn't give much information on the drug side effects. Yes, right. All right. So if you're enjoying this session and learning, please make sure you like this and share it with your friends or colleagues who might also benefit from preparing for OET or who would like to improve their communication skills. So here is the next setting, the scenario where you have to again spot the problem. So the health professional is telling, Alice, you're getting old, and that's why you have frequent falls. You shouldn't live alone. But the patient says, I'd rather die here. That's a dire situation. So it's your time to type in what you think is the problem so that we can get going. Now, there's a huge variation in how independence is viewed in different countries. For instance, in most Western countries, there's greater value for people's desire to be independent, whereas in many Asian cultures, it's not appreciated as much. Thank you so much, Gurleen, the only other OET All-Stars from Asia, says it's lovely slides and lesson. Thank you so much. So good to have your support as always. Asel says it's unprofessional, right? No empathy, that's Nessie Banda. Yes. So as your responses pour in, I'd like to tell you what I think the problem is. It's judgmental, absolutely. Of course, it's unprofessional, there's lack of empathy, all of it. And then there's something called ageism. Now, ageism is a term which was coined some years ago, where it's a specific judgmental statement where the patient's age is the subject of discussion, and that's absolutely unacceptable. So let's think of how this could have been done better. Here we go. So the professional says, Alice, you have had a few falls. Would you mind if we conducted an assessment for independent living? And the patient responds quite positively. She says, that sounds great. I know that I may need some assistance. So there's nothing wrong in suggesting that the patient might, have to take some support, or as in this case, conduct an assessment for independent living, so that the abilities and inabilities of the patient to go on with ADLs and other things could be considered, and then a right decision could be later. But putting it bluntly, in a judgmental way, where ageism is involved, that's where the problem is. Okay. Yes. So here we go. Here's the next scenario. I've got two more scenarios for you before we do some other activities. So let's quickly spot the problems. If you just lose weight, your symptoms will go away. And the patient says, I could hardly breathe yesterday. Hurry up, everyone. Yes, fat shaming, hustle, very good. Yes. So it's medical fat shaming. Just like ageism, this is also another kind of judgmental approach or statement, which is absolutely not acceptable. So how can we do it better? How could the professional have done it? Now the patient's statement doesn't change. She still says, I could hardly breathe yesterday. And instead of fat body shaming, the professional now says, I'm sorry to hear about your breathing distress. Can you remember what might have brought it on? So yes, that's right, Asal. Asal says sometimes people might not be able to lose weight due to thyroid issues, or other health factors could be contributing to it. Sundari says you may consider losing weight. Yeah, but you can't come directly to it. After probing, and then eventually perhaps you can make it as a suggestion. But again, it should be done very softly, gently, without judging. hurting the sentiments of the patient. And also, you can't assume that this is the reason. There should be evidence as well for that. So here is the last spot the problem activity for you. The professional is asking, are you a drinker? And the patient says, I have some beer at night. Okay. Let's see how it moves on. So the health professional says, I see, you must stop it immediately. Right. So again, that's judgmental, that's hierarchical. Yes, how much do you drink? Did you drink recently? Yes. How much do you must not use must? Yes, Sundari. So you can use must, but not in a tone when it seems that you're ordering. No. Okay. So here's a better way of doing it. Do you consume any alcoholic drinks? I have some beer at night. All right. How much? 3 glasses, typically. Okay. Would you consider reducing it? So that's a good way of probing if the patient is willing. The patient says, no, I don't think I can stop. All right. That might be, shocking for some candidates, because in some cultures, it's not accepted by health professionals, and it's highly considered, people might think that that's a bad habit. I'm not saying it's, to tell that some habit is bad or good in itself is judgment. So the professional says, okay, it's your decision at the end of the day. Let's now discuss. So interestingly, the health provider, the care provider, the nurse or the doctor, whoever it is not trying to push their agenda. And they might discuss the consequences, but it's ideal not to push it down their throat. So here what we see is that it's non-judgmental and accepts the patient's decision. So at the beginning, we did discuss that. It's important to accept the patient's decision. So, right. So this session comes to you from IRS group. And if you're interested in taking up online sessions with IRS group, we'd be happy to give you a demo class. So Indian numbers are on the screen, and you can call us or send a WhatsApp request, or you can go to our website at irsgroup.in and request a demo session. So I'd like to do a mini mock with you. I don't know if I can call it a mini mock, but I'll be taking some of your responses on the role play card that you have on the screen, and how you can respond while not being judgmental and upholding the patient's right to their opinion or views. And in so doing, which all criteria are covered, and where all you can score better. So that's something that I'd like to discuss with you. So the setting is a community health center. And here it's a nurse's card, but it's absolutely all right for any professional, whether you're a doctor or another healthcare professional. You see a 55-year-old patient who has visited the community center for a routine checkup. You just taken their vitals and is discussing his or her vaccine status. The patient has previously refused to take COVID-19 vaccine. So health professionals would have gone through this scenario quite a lot if you have been in the primary care or involved with COVID treatment and all. So you've got, I've just put 3 tasks, just enough for us to cover this. So greet the patient, confirm the vaccine status of the patient, records show not vaccinated, find out the reason for not being vaccinated. So if there are any medical conditions or concerns or questions, right? So how can you take this without being judgmental? You can start typing your responses. I'll give you a moment for you to type. You can also post the conversation part to me and I'll reply. For the previous scenario, I guess I see a reply, which was Sundari Singh saying, you can try going cold turkey. Okay, you should say, I'm not asking you to go cold turkey, not to go cold turkey, which is to abruptly stop something. Okay, Sundari has a response. Can you please describe what is making you not to take the vaccine? Yeah. So I reword it slightly. So you can tell the patient something like, I see from your records that you have not taken the COVID-19 vaccine, and I would appreciate it if you could describe to me the reason why you thought you did not have to take it. Yes, Rayhan says something similar, if you don't mind. May I ask you why you did not get COVID vaccine? Yes, absolutely. So it's basically trying to understand and incorporate the patient's perspective. But it also involves, when you deploy empathy, it's also relationship building. And sometimes you might know that their thought perspective or, could be wrong. And as a healthcare provider, you have every right to tell them that. But before that, you need to know what it is that prevents them. So Asal says, explain the risk of not getting the vaccine. Yes. So for instance, if a patient just told that they are concerned that there could be serious side effects, you have to acknowledge their concern primarily. And then if you have any information on, let's say, the evidence of what the side effects are from studies, trials, you can share that. So, some of your fears could be out of place, and this is what the recent studies have shown. So I was wondering if you could consider taking the vaccine. So when you do that, basically, when you do these 3 bullet points, you will be, I would say, having almost all the criteria covered in different forms. Lekha says, well, Mr. X, thank you for allowing me to check your vitals. Based on your record, I came to know that you haven't been vaccinated yet. May I know why it is so? Okay, yeah. I'd appreciate it if you could put that final question slightly more, make it more open and enabling them to explain their perspective better. But it's quite a good response, yes. So it involves information giving, information gathering, relationship building. Definitely you have 3 bullet points. So you have to provide a proper structure, signpost as you go. Just mentioning the clinical communication criteria because definitely the linguistic criteria are important and they do get marks, but I'm just trying to focus slightly more on the clinical side of it. All right, so let's wrap up with some questions. I'd be happy to take your questions, which will help me to not just answer your questions right now, but also incorporate them in the upcoming sessions. Yes, foster relationship building, I suppose. I don't get the question, but it's something which is quite important because that's where you build rapport, you show respect, you have to be, an active listener, and yes. So make sure your introductions are appropriate as well. For instance, this bullet point had the prompt, greet the patient. Now, I have to tell you that sometimes not all role plays are from the beginning. So do it appropriately. Asal is asking, how long does OET test takes? Well, you will get all the information on OET's official website, occupationalenglish-test.org. Asal and OET speaking test is roughly 20 minutes. So you have reading for an hour, writing around 45 minutes, and you have listening also, which is roughly 45 to 50 minutes. So it depends on which country you are taking the test, how often it's run, but usually you have an OET test every 2 weeks. Oh, thank you so much, Sundari. It's a privilege to be able to help all of you through OET's official platform, OET All Stars. Taurus, you can put that question across to OET, or quite often you have OET Q&As run by Rebecca or Alex or Shekinah. So you could put those questions across for the OET officials to answer your question. All right, excellent. So thank you everyone for having me help you with your OET preparation. And IRS group is absolutely delighted to be able to help you and provide a lot of these sessions. Thank you, everybody. I'll see you soon in another session. Thank you.